welcome to the Pause It Podcast. I'm Dr. Sam, and with me is Dr. Robert. How are you doing?
Hey Sam, good morning. How are you doing today?
I am doing really, really well. We have a guest today, which I love so much. This is Dr. Christine from Jope. She's one of the co-founders of Jope. And I'm going to let you kind of explain what that is, and we can kind of have a bit of a chat. It's always great to have another veterinarian with us. We just love having guests. So thank you so much for coming.
Well, thanks for having me today and for allowing me to, speak to your community. I really appreciate it. So I'm the co-founder of Jope, which stands for Joy of Pets. And we are a new pet wellness company. And our first product is a joint supplement for dogs.
Mm-hmm.
So we're relatively new. We started in 2021. And right now our main focus is basically to help dogs maintain or regain their mobility.
Wow, I love that. And actually, the last podcast we just did, Robert, was on arthritis. And
Yeah,
so we were actually
we're doing
just kind
well.
of, yeah, exactly. This is like perfect timing. So we were just kind of talking about that condition, so our listeners would really understand why it's so important. And I would say, for me as a practitioner, I'm general practice, in case you didn't know, and then Robert does emergency. And I always find it really hard when people ask me, well, what's a good joint supplement? Because there are so many out there. And I feel like most of my decision making when it comes to that comes down to either feedback that I've heard from the patients that I'm seeing, like the owners, and what they're noticing, or just honestly what I've been using because it's what I know. And there are just so many out there. People are like, well, what do you think of this one? Or what do you think of that one? I'm like, just not familiar with the brand, so I don't know. You know what I mean? So I'm interested in a couple of things. Like, one, why did you start with a joint supplement? And also what makes you guys different? Like, what's your whole story?
Well, I can appreciate that, for sure it's a crowded market. We did know going into it that we were going to have competition. So at least we were prepared. And the reason we decided to, build a company and start with a joint supplement comes from two things. Like, first of all, we're veterinarians. So me and my co-founder, Dr. Jeremy, we're both veterinarians. We always wanted to be vets and help dogs and cats and basically any animals for as long as we can remember. And so we wanted to really just commit to what we were taught in vet school and help the community at large, humans and cats and dogs, because that's what we specialize in. And then why did we decide to start with a supplement for our pet wellness company? It's because I had a dog when I actually met my co-founder in vet school, whose name was Pepsi. And he's the
Like,
reason we started this adventure. I wanted to call the company Pepsi, but then I figured that would probably not fly. So we had to
Probably
pivot.
not.
the
Um,
lawful procedure.
and so actually Pepsi is the one who really made me discover the world of supplements. So he started developing arthritis when I was in vet school. And at the time, we learned all about the disease process, how to have a multimodal approach to managing it. So, weight management, physiotherapy. And we had to give Pepsi NSAID because he actually had very severe bilateral hip dysplasia.
Oh.
And so he really, like, I basically went to vet school and he was running with me like 8 miles, 10 miles, no problem. And then it felt like I came back, and within 8 months, 6 months, he just could barely do, a few miles.
Oh.
So that's when we took him to a vet. I started looking into it. And what happened is that Pepsi didn't tolerate very well the non-steroidal, because his stomach just wasn't up for it in the long run. And so with my mother, who was also watching Pepsi, and she basically was the one caring for him on a day-to-day basis, we tried to find a supplement to help him. And that's where, what you were saying really resonates, because what we found is that there's so many options. Even at the time, it was like in 2010, 2012, but it was just, even though it wasn't as crowded, you already had a lot of product on the market. And so I started just trying everything, but that's when I realized that it wasn't working for him. And so I kind of went back to the drawing board with my co-founder, my teachers at the time, and I tried to have a more scientific approach, looking at studies that had been published on supplements or ingredient used in supplements. Because if you talk about the product, there's actually few studies on products, right?
Yeah, hardly
But
any.
Yeah, you have maybe like 4 companies right now that have studies in the mobility category I'm talking about, but at the time it was even fewer. But what was available was studies on the active ingredients. And so we basically started looking into it, and that's how I discovered UC2 collagen,
Uh-huh.
um, which is the main ingredient in our chews, and that really changed Pepsi's life, like for the best. And so he's kind of the inspiration behind Jope, because we noticed just that, after graduating from vet school, unfortunately, Pepsi had also a degenerative myelopathy. So, he had to leave us at some point. But I just always had a soft spot for supplements, seeing that, there's a lot of things out there, but all kind of similar with glucosamine, chondroitin, and very few or none with UC2. And that's why basically in 2021, we kind of paid tribute to Pepsi and we decided to come out with Jope.
Okay, I like that. So
Yeah.
you said that you worked with your professors at the time as well to
Yeah.
kind of pinpoint what would be the most useful ingredient.
Yeah, we were just trying, like, I was asking, a little bit everybody like what I could do, because Pepsi kept declining, and I think the fact he had, he was getting older, we caught it late in the process too. So I was trying to figure out what to do, and some of the professors, is at the time you're in vet school, you're like looking at studies, and people just mention different ingredients. And so with Jeremy, actually, what we did is we took like all the study available at the time and started like reviewing them and thinking like which one would give us the better outcome for Pepsi. And that's how we started with UC2 collagen. We added that to Pepsi's diet. It worked really well for him.
Hmm.
And then little by little, we wanted to add more, and we started thinking like what could be synergistic with UC2. And that's how we added omega-3s, because, they act on a different part of the inflammatory cascade.
Right.
UC2 has a very specific mode of action, which is called oral tolerance, which is very interesting. And I can go over it later if you want. But so basically the logic is kind of, we find a product that worked, but how can we add to have an even broader coverage and improve Pepsi's comfort further?
Hmm. Did you find at all that so when you kind of pinpointed the UC2, which I think one of the other problems is that like you can find supplements that have whatever ingredient, whether it be UC2 or glucosamine, chondroitin, whatever. But when you actually nail down the amount that's in the supplement itself, you start to go, okay, yeah, sure, we've checked that box, but that is not enough to do anything. And so
Mm-hmm.
is that part of what you were seeing?
Yeah, so you mean for Pepsi specifically, or for...
Just when you were looking for that ingredient, because I feel like that some so often like people are like, oh, I have my dog on a a omega-3 fatty acids, and it's like, but do you really have enough of
Yes.
the EPA in there that like actually is going to make an anti-inflammatory difference, or are you just sort of throwing something at them that really okay, you can check that box, they're on it, but it's not enough. So did you struggle to find that specifically like in the amount you needed, I guess was the
That's
question.
actually an excellent, yeah, it's an excellent point. And to begin with, I didn't really pay attention. Like I literally was just trying everything like anybody would, it's like, I need something, like give it to me.
Mm-hmm.
But so I tried Pepsi on every product we could. And one of the big issues, what you're saying, is like, not only are they using ingredients that are not necessarily demonstrated to be effective in studies, but they're also underdosing it. So they're not actually using therapeutic dosing. That's what I realized after like going over the studies, because in the studies, if you're gonna base your research on studies, then you want to use the dose that is also in the study, right? Because let's say logical, and what we're doing. And so that's when I realized exactly what you were saying, that like 99% probably of the product out there are underdosed. And also the quality of the ingredients are not necessarily what you think. Like glucosamine can have very different origins, and there's no guarantee of quality.
Right.
And so that's what I realized afterwards. And when I started trying, new products, I really was looking at dosing, what were the ingredients and quality. And then for UC2, what I did is I just used the dose in studies that had shown benefit for dogs. And for Pepsi, it was pretty significant and very quick that I saw results. Like it happened within 2, 3 weeks. And then it just kept like improving. It's not going to be the same for every dog. Like we have a vet who's giving it to his pup, and it took 5 weeks. but at some point, like, it's going to be very obvious. And so the approach we had when we formulated Jope was really to keep, like you were saying, the dosing that were in the studies showing benefits. Because otherwise we would have been like any other company, taking something that sounds good, putting it in there, ticking the box, but not actually, like, investing in a product. And UC2 is also very expensive, and that's why, like, our product is more expensive than many out there, which people don't understand. And we could have cut the dose in half. We could have, make it cheaper, but then it wouldn't have helped dogs as well as it does now.
Did you
I think
have
that's a really
trouble sourcing it? I'm sorry, what were you saying, Robert?
also I think it's a really good point because I think sometimes you have to afford to pay a little more for like the quality of something, and people are paying attention to the buzzwords like, oh, UC2, or like everybody knows glucosamine and chondroitin. I don't think that many owners know UC2, to be completely honest with you. But they see the buzzwords and like, oh yeah, my dog's on that, or they're on that grain-free diet, and they hear the buzzwords, but they don't realize the impact of it, how it's actually helping their pet. So I think I really loved when I was talking to you initially, because you're just talking about like how you're using really science to back up what you guys are doing, even from the foundation of your ingredients to then utilizing it in studies afterwards, which I think is really quite cool. So on the veterinary side of things, that allows us to be more confident when we're sharing things with pet owners too.
Yes, because I think I actually shared with you, we did launch a double-blinded placebo study this last month with a third-party independent, very well-respected animal hospital center in the US. So we're super excited. Fingers crossed, it's gonna show what we think. But I think just, that does speak volumes. Like, we're a company that's about a year old, and we invested, like, our own money into creating a study to put, to show that what we're really trying to do does work, or at least, invest in it and put like proof and energy into showing that it's going to help your dog, which there's no, like, very few company actually do that. However, the ones sold through the vet channel, like, most of the product are going to have studies behind them. They're not always as effective as you would hope, but at least, the companies are investing. But in the direct to consumer, I think that's what people don't realize. It's like anything can fly. There's no regulation, and nobody's really doing any studies.
Mm-hmm. Yeah.
Because it's easy, great marketing, no science, and then just sells.
Well, I
But this
mean,
help
that's what
dogs.
happens though. How many times have you as a veterinarian, even just what you said, Robert, with like grain free and all that, like it was like a buzzword, and there was no science behind it. It just ended up causing problems.
So many
Yes,
problems.
I think that's big, like, the grain free too. I mean, obviously it has kind of nothing to do with our chew, but I agree. Like, it sometimes it's really hard to see just like things people don't realize. Like, they have the best intent,
Mm-hmm.
but they don't necessarily understand what they're doing, and that can really harm, their dog or cat. So that's hard to see. And we want to not be a company that does that, like, encourages people to do things. We want to make them understand what they're doing, why they're doing it, answer their question, base everything on science as much as we can.
Mm-hmm.
I think even just the importance of, because I'm not sure if many clients know, but like doing a prospective double-blinded study, what that means for something, because most of our studies in veterinary medicine are retrospective, where we're looking back at pets that we didn't have controlled environments for, we're just taking information like maybe they had this disease, we knew they were on this medication, we want to see how they turned out, but we can't account for a lot of the variables. Here, with being a prospective study and being double-blinded, which means no one knows what they're on, like, it just makes it such a cool way to prove what you're doing. I think that's just like there's studies out there. So like people have studies, but to have like this type of study is one of the reasons you caught my ear when we were talking at the conference. 'Cause I was like, that's something cool, because you're not just taking back a bunch of medical records and saying, oh, this dog was on carprofen for 6 months. Let's see if it got better. Like, there's so many things that go into that. And so just having this type of information available to vets and owners is really cool.
Yeah, thank you. Thanks for saying that. And it is true. We're doing like the real study happening live as we speak, actually.
I think
Well,
that's one of the benefits, though, for being founded by two veterinarians, that you understand not only the deficit that we have, but then also the rigor that it takes to be able to say, hey, this is actually better. And we know that for sure. And that's a really unique sort of a situation that we don't really run into very often in veterinary medicine.
especially in supplements. I think, you know, for the drugs, they obviously need to show efficacy, but supplements is not regulated. So like anybody can go out and, you know, create a supplement. And that's where we come in. Like we really want to make it different. And our goal is to kind of apply the standards of pharmaceutical companies to the products we're bringing to the market. So we're really, you know, putting the science in the formulation. We're testing every single batch, third-party testing. We're doing this double-blinded placebo study. So we're really going like all in to put as much data behind what we're selling.
Wow.
Yeah.
That's
I
very
love it.
cool. Yeah.
And so obviously this is your current project that you're working on, your current supplement. What's
Yes.
step 2? Are you focusing on cats next? Are you focusing on, or is that, you know, secret information we can't know just yet?
I won't give you the full secret, but no, we were saying in dogs right now, the reason being, you know, we're a smaller team, younger team, and the cat market, although untapped, is definitely smaller. But our product can actually be eaten by cats and can benefit them. Anecdotally, there's really good evidence of UC2 helping cats. There's no studies. But the only thing is, it's the formula is made for dogs, so palatability is more for dog. But if you have a cat and you're trying Jope, it can really help them. You can mix it with the food. So we are still, you know, kind of doing both. But the next one is mostly going to focus on like our pets that are overweight. So that's kind of what we would like to go into, because we know there's more dogs. Like it's staying in this mobility kind of realm with more dogs gaining weight. And that really, I think people don't always understand the impact it can have on, you know, the body. It's going to be pro-inflammatory, which obviously in arthritis is one of the big issues. If you guys had a podcast on it last week, you probably know. And
You're
it's also
speaking my language.
and
See, it
it's
wasn't
also
just me and Robert making it up.
Exactly.
We didn't plan this.
So yeah, so we just that's what we're thinking, but we have many ideas, and honestly, the thing is that the need for supplement, the beauty of supplement is that it can not only help with curative treatment, so you can add it in a multimodal approach, like for dogs that have arthritis, known arthritis, you can use it to help, for example, like Pepsi decrease the amount of NSAIDs. But you can also use it like younger, because UC2, for example, has a study that was done in younger Labradors showing the benefit of giving UC2 over 30 days to improve recovery time and also decrease inflammation in the joint for these micro trauma that happens, you know, during exercise. And so you can actually use them earlier. And if you're choosing a safe product, you know, that's like, you know, where it's made, preferably in the US, you know what's in it, you can actually start your dog sooner on it, which is the other nice part of supplement. And there's a lot of other realm of pet health that you can really, I think, enhance with supplements if you're thinking about it the right way.
Mm-hmm. Yeah. Well,
we're excited.
I have a 3-year-old lab, and so every time we have these conversations, I always am thinking about that. Like, I want his mobility long term to be as good as possible. So I mean, I'm like very strict with his weight, number one, but also two, I like the idea of protecting those joints.
Have you started anything yet, or?
So I really have not, and I really should, and I'm gonna be really honest. And he'll eat anything, right? So it's not even that hard. So I was actually curious to know what form it comes in. Is it a chew? Is it a powder? It's a chew.
No, chew. You can crush it. It's like you can crush it. It's soft enough, because we know that a lot of the dogs with arthritis are going to be older. Sometimes they don't have other teeth. So the idea for our chews being soft is that any dog can eat them. So you can actually crush it and mix it in the food.
Oh, that's
I've actually had it myself.
Yeah, I was gonna say.
I was laughing to myself because she was going over the palatability of it. I was like, no, actually, it didn't taste bad at all. Like, I had a bite of it. I needed some water afterwards, but besides that,
literally, yeah, Dr. Howard just literally like stuffed his face with my chew, and I was like, okay, it's happening.
It is safe. My joints felt great afterwards. So.
Yeah, that's good. Maybe I should start taking it.
Right.
So yeah, it tastes, honestly, I've tasted them too. They're a bit dry for my taste, and they're big for a human. Like, it's kind of big for us, you know, 4 gram. But they taste like, I don't eat meat, and they taste pretty fine. Like, very, I don't know how to say it, not too, like, just good. So Even for something that doesn't eat meat. There's no meat in our chews. That's why. Not that we don't think dogs can eat meat, but we just want to make sure that dogs that had like food allergies could still benefit from our supplement. So that was
Another good reason why veterinarians being the ones, because it's like the first thing, you have people who need to do diet trials or whatever else, and then you're like, yeah, you got to stop all your supplements. You can't, and so that's a very good thing.
Yeah, the only protein in Jope is actually the UC2 collagen, and that comes from chicken sternum. But because it's such a specific type of protein, which is the type 2 collagen, which is in cartilage, not in the meat, I'll just tell people it is a protein from chicken, but very unlikely that your dog would react to it. And also, it's not absorbed. So UC2, unlike the glucosamine and chondroitin, where you need it to be absorbed for the body to process it, UC2 is actually going to simply interact with the Peyer's patches. So they're a part of the immune system in the stomach, well, in the digestive tract, not stomach. And what it does is UC2 is going to basically interact with cells in the body and the gut, and it's going to indicate to the immune system to decrease inflammation at the joint level when they see cartilage damage in the joint, and therefore pieces of type 2 collagen free in the joint. So UC2 is actually not being absorbed. It's really just transiting through the body. Yeah, excreted, and then it's going to have an effect over time because it's really training the immune system to have a healthier response, which is going in turn to help arthritis like decrease the speed at which it's evolving. Yeah, and that's why you can also use it in younger dogs because it's not being absorbed. You're really just training the immune system to have like lower response to inflammation, even if you're just doing like small activity or jumping. Like dogs have to jump and run, like that puts pressure on the joints.
Right.
So that's where UC2 that comes into play.
That's really.
I did not know that. That's really cool to know.
Yeah. I definitely I think that it's one of those ones that I have heard of before, but I was not terribly familiar, and certainly not with the mode of action. I mean, I definitely did not know why.
I can send you an email with all the detail.
Yeah. Hey, if you would, I would appreciate it because I think that managing arthritis is one of the things that we do most often. You know what I mean? And I'm always people are always asking like, well, which one should I be doing and how, and sometimes people will ask you like, well, how is it helpful? And I'm like, okay, well, let me give you the answer. So yeah, if you'll send it to me, I will definitely read it.
And if you want your lab to try them, I'm happy to send some too. And yeah, it's because I think people forget that actually the canine arthritis management group, they reported that arthritis is actually the #1 cause for chronic pain in dogs. And there's like 38% of dogs of any age that have or are going to have arthritis, which is very high. And once you can't move, you're kind of like your whole body is likely not going to be as healthy because you're not able to move around. You're going to become stiffer. You're going to put on weight. It's kind of the beginning of a vicious circle.
Yeah.
So yeah, I think it's really important to just remember arthritis is our enemy and we want to combat it as soon as we can.
Yeah.
Absolutely. And do you guys do you recommend using Jope with other medications, or like obviously there's some newer stuff like Librela, is that for the canine? Is that recommended to use in conjunction with it separate? Like what's your thoughts on that process?
Yeah, I think, again, supplements are meant to be used in a multimodal approach. And so I think, when you're a veterinarian, you have a lot of tools at your disposition to make your patient feel better. And so the nice thing with supplements is that because it's kind of a food concentrate that doesn't have adverse effects unless, you choose the wrong one or your dog just has anaphylactic shock or something. So like a really big allergy. It's very unlikely anything's going to happen. So you can really use it with anything. And to my knowledge, there's no known interaction that would be detrimental to the pet. Definitely for UC2 and omega-3s and curcumin, which are in our chews. Pretty sure for the other, it's similar. Like that's not just us. It's kind of the nature of supplements. The only thing is actually UC2 was shown in a study to be less effective if it's given at the exact same time as glucosamine. So we just say, because I think glucosamine needs to be absorbed and there's big quantities, right? Sometimes you need like 1,000 milligrams to 2 grams to be able to get benefits. Whereas UC2, it's a few milligrams, and also UC2 is not absorbed. I don't know if that's accurate, but what we did see in the study is just if you give them together, it doesn't work, UC2. So you want to separate them like 8 to 6 hours. And like that, there's no problem. But any other medication, it's certainly no indication, contraindication that I know. And it can actually help like decrease the amount of NSAID potentially. We have a lot of people using Librela with Jope, and they say it's like a great combination. The dogs seem to be feeling better longer.
Mm-hmm.
I mean, anecdotal data, people who love Jope, so
Yeah, of course. But it would make sense though, because with Librela, I mean, you're blocking the nerve growth factor from the diseased joints, but you're not doing
Yeah.
anything to
So
address the inflammation or really to fix the joint. So you
yeah.
would imagine that you would need something to sort of like still promote the health of the joint.
Yes,
And so that
exactly.
would make sense.
Yeah, and I think that's what some people forget is like all these, like a lot of drugs are great, right? Like even NSAIDs, because they're preventing, what you want is always improving quality of life. So if you're giving an NSAID or Librela, you're making the dog feel better. But the thing that we need to remember is that you're not really helping the body to get healthier. You're kind of, like you said, stopping the receptors from feeling, blocking a certain chain. But so if you can add something that's actually gonna help just the body be a bit healthier, like that can't really hurt. And so maybe you're not going to need to give the drugs as often or as much. And I'm not saying you shouldn't give drugs. I think it really depends on the patient.
Right.
I think drugs have, sometimes I take NSAIDs because I need it, but I think to be mindful is beneficial. And to really think about our cases, the patients we're seeing as like individuals, and what is going to work for one might not work for the other. So it's fun. That's why we became vets, right? So
Yeah.
we're never going to be bored.
Never
Exactly.
bored.
Because
Yeah.
once you think you know something will come along that's like, nope, not going to work this time.
Not expect that. Yeah.
Nope. Got to try
So,
again. So I'm curious too. I wonder, so you went to vet school in France. You and Dr. Jeremy, right? Both you were
yeah.
classmates in France?
Yes, Jeremy and I were both classmates. If he was on the podcast, he would have a very thick French accent. He would be speaking English this way, but next time he could be on. Yeah, he's in France actually right now too.
Oh, very fun.
Yeah.
Do you find there's a difference between the like supplements that you were familiar with being at a French school versus what you've seen that is more common in the US? Or like, because I'm wondering if you knew of UC2 more so because it's just a little bit more ubiquitous in France, but here I feel like that's not the first thing that we hear of here. So I'm curious to know, right? I mean, don't you agree?
Yeah.
Yeah, it's a good question. I think we learn like first the molecules. I don't know about you guys in the US, but when we learn drugs or any product we use, we only learn the name of the molecules. We don't learn like product name. But I remember learning about, so I don't know if it's a thing, we just don't learn brands. We just learn, is it different?
Yeah, I think so. Because
That's funny.
well, I don't know. I mean, we use a lot of generics, but we always use the name of the like the name of the drug. So like gabapentin, you know what I mean, or like something like that, like or carprofen, or you know what I mean, like. So we usually do, even if we're using the. Don't you think? I feel like everything
a
has
lot
a
of
name
pharmacokinetic classes is very much like here's the brand or the generic name,
of the drug. Yeah,
and then the
not so
difficulty
much
was
the
naming the brand.
compound.
Yeah.
No, so us is the opposite. We learn the compound in vet school. And then, when you go in clinics, this is when you associate like the compound to the product, because then you see the brand names or the generics or whatever. And I do think there's differences. Like, for example, in France, I was familiar with UC2 from school. So like we learned about it in vet school with glucosamine, chondroitin, omega-3s. Not so much like curcumin, also not as much Basilia serrata, not as much green lip mussel at the time. But we didn't have CBD, for example, which I actually discovered when I came to the US. So I tried Pepsi on CBD. It actually, like for him, it didn't work. So it was different in that aspect, but I think CBD came a little bit later as well.
Right.
I think in France, it's still not as common from what I'm hearing.
Still figuring it out here too, I think, in terms of like the dosage and the quality,
Yeah.
the regulations. Like we've got a whole bunch of stuff we're still trying to get through, I think, as a country. But I've heard some good feedback from some companies. some
But again,
maybe.
I think it's about dose and about where you're getting it from. You know what I mean? I think the biggest problem is now you've got so many companies that are just like, oh, well, sure, we can throw together CBD. We're doing it for people. We're just going to give a pet version of it. And then it's like, yeah, but it's not the right dose. And who
Yeah.
knows? You know what I mean?
Yeah, it's never easy, and CBD is one like I don't know enough to want to necessarily speak about it, but I do
Right.
think the fact it's not regulated nationally and every state needs their own. It seems that's also one reason we didn't decide to go into CBD.
Right.
And the studies, there's only studies done with one company, so it's a bit harder. I think to assess like, is it really doing something scientifically from our standpoint? So.
Yeah.
No, it's I think a lot more information is needed, and a lot more work needs to be done just in general. But Jope, I really like though. I think
Yeah.
sounds great.
Well, but I that's actually I think the whole point of like why what you're doing is different and that your approach is different, and it's one that I think we really appreciate, just as being practitioners, because I know that I would really love to be able to answer the question, well, what joint supplement should I use for my dog based on something real versus like, oh well, most people think that this one's good. You know what I mean? Or I've heard a lot of people say they like this, so
Yeah, that I think that's the reason. Like, we really hope we can help vets just feel more confident when they're recommending, knowing that we're doing the homework for them. So,
yeah. Well, that's really exciting. So, can you share? Do you guys have a website, or how can people even get your supplement?
so we have a website. It's Pet Jope, so PETJOPE.com. We're also on Amazon. We're the ones selling the product, but we prefer not Amazon. But if you have and then we sell through veterinarians too.
Oh.
So, if your vet carries it, you can get it there. Or if your vet is interested, you could send it away. So it's really pretty simple. It's either our website, petjope.com, or Amazon or veterinarians. And we'd love to partner with more vets. Because like you said, I think there's a lot of confusion out there, but there are more and more studies and there's things that can be done to really have a thoughtful approach. And I think it can help improve our medicine, improve the quality of life of our patients. So, we're hopeful more vets are going to want to use Jope and talk to us. So thanks for, initiating the conversation, Dr. Sam and Dr. Robert.
Well, we appreciate that you've come on, and if people have questions, sometimes people send us questions and we can send them to you, so they can send them to podcast@mybalto.com. And yeah, we love stuff like this. Science driven, real evidence-based medicine is how we like to practice. And so in a world where a lot of people really want supplements for their dogs, but they really want effective ones, it's really, really refreshing. So thank you so much for taking the time to come talk to us.
No, of course. And again, I'm happy to send you all the information, the studies, and if you want to try the product, happy to send you some samples as well.
That would be awesome.
If you eat it, you film it, and then you should Dr. Robert.
I'll eat it in person. That's fine. So, okay, now we'll share people bites. Be great.
Next time, I should have got you a sample so that you could have done it live.
I'll do it live. It's fine. I have no shame with it. I've eaten worse. I'm sure I have. So yeah, we really appreciate you being on today. And if anybody has questions, they're always welcome to ask us. And hopefully, if you have a veterinary clinic, you'll adopt Jope at your clinic as well, because I think it's a great product.
Yeah, that's awesome. Well, thank you everyone for listening. This has been the Closet Podcast.